My name is Piero Papa. I'm 63 from Canada. Before I was in the most pain I've ever experienced in my life. I'm very active, and to manage that pain, I needed to take a lot of painkillers, a lot of anti-inflammatories, and I did that for approximately 6 months to discover that I needed microscopic surgery. At that point, I needed to do something. I could not wait in my country for a 3-hour procedure. I was admitted in the morning. I was given a full scan, stuff we don't do back home. The MRI was 3 times longer than back home. The care of attention was, the word I use, if it's perfect, is called impeccable. Absolutely. I was prepped. I was instructed what was going to happen, the amount of time, and I was put to sleep. Surgery, I woke up 5 hours later in a beautiful environment, wheeled up to my room one night, and I walked out with crutches 30 hours later. So the treatment from the time I came in to the time I left, and then the follow-up, come back after 4 days and analyze and check the stitches, and again it was impeccable, flawless. I have no crutches, no cane. I have full range, and I'm not kidding when I say this. I probably have more range in my operated hip than I have in my non-operated. Cross both, I can cross. This is my operated leg, and this is crossing it over. I would hand deliver them here, take by the hand and bring them to the hospital, personally. Everything, this experience was 5-star. I have made that very clear to my friends back home. I'm not sure if this is appropriate for me to say, but quite a few individuals, my friends, when I told them what I was going to do, they have no idea. They have no idea that you guys are way more advanced than we in the Western parts of the world. We have private hospitals too, but the service is maybe half of the service I received here. I say that kings and presidents get this kind of service. So of course I will tell people, don't even think about it. I was consulting with my own doctor back home. I would get my reports and send it to him. It was my doctor that said, you're there, do it. Here I am. Thank you guys. Go for it. All righty.
This patient come in with the pain in the hip for nearly a year. The pain starts when he sit long enough or bend his hip for any activities. And we examined him and found that he has impingement condition. Impingement of the hip is not the most common cause of hip pain, but it requires specific treatment to prevent the hip to damage and end up with arthritis. Now, if you look at the socket of the hip here, the labrum is the extension of the socket. If you grab the head to control the stability, when the patient have a tear of the labrum here, in this particular patient, he has a bump here that developed when he was young. When he has a tear here, we have to repair the tear before arthritis develop. The tear normally starts here. If we magnify this image into here, you have the labrum extension, and the tear will extend along the labrum. We have to intervene before this tear cause extension of the tear to destroy the cartilage in the socket. So this is how we treat the patient. We put a small camera in the joint. This is the cartilage on the femur, on the ball, and this is the socket. You can see that the tissue in this age group, 60 plus, is not very strong. So the technique to repair this, we have to make a more special type of suture. So we repair all the frayed tissue and make it a firm, functioning labrum again. We use arthroscope because arthroscope allows us to work precisely, especially we don't want to cut any muscle. This will make recovery faster. This patient, we let him walk the next day. He walked with crutches, of course, but he can go anywhere. And within 2 weeks, he was walking normal. 1 week after surgery, he said he can sit, he can move his hip to any position. He's now went back to Canada. So if you have hip pain, even the pain at the hip mostly come from the back. The minority of the patients that have pain at the hip that come from the joint pathology, for example, labrum tear, can end up with very bad consequence. This happens normally in a young population, 20 to 40, 50. But if you are an elderly patient, 60 plus, but you're still strong, and you have any twist, any minor bang on furniture, then you may end up with fracture. So you have to make sure that this is not the case in your hip pain. So please come to us and let us check and live with the hip strong, with good muscle, enjoy life.